Morning to you, Blaine, and good morning to the viewers.
Look, when people are stressed, they often need the physical and emotional support of others. Now, if they are in isolation or in quarantine, even social distancing, they can't get that. So what is the biggest risk to people's mental health at this time?
That's a very important point to consider, Blaine. Social isolation, of course, is contraindicated for mental illnesses such as depression, for example. So what we as psychologists are encouraging is mindful connection. So we don't want to be disconnected from everyone, but we need to follow the procedures that have been put into place. Meeting not in public areas. We could meet in our homes, following the hygiene practices, using social media and using online platforms to increase connection with those that are close to us and those who are good for our mental health.
So if put in isolation or quarantine, because there's a difference here. Quarantine is when you take people who are healthy, who potentially were exposed to an infectious person, and separate them from society for a fixed period of time. In this case, it's between 14 days to 21 days to monitor them for the illness. You are more likely to be put in isolation when you test positive for the disease. So you saying one of the biggest things that we can do, engage with, is the use of social media?
Absolutely. So any form of technology, if we cannot make physical contact with others, we need to use the resources that we do have at our disposal to connect with others.
You get a sense, Rakhi, that there's some sort of panic in South Africa when we look at panic buying, for instance, the buying of sanitizers, wet wipes, for instance, toilet roll even. Why do people react this way? Is uncertainty the biggest driver of panic?
Uncertainty creates a lot of fear, Blaine. So what's really important for us is also to be mindful in everything we do and compassionate to ourselves and compassionate for others. So while we must be prepared for the worst, we must also hope for the best, but be compassionate to other people. So if panic buying means that those who might need resources more than us are going to be deprived, we have to be mindful of that and let that advise our shopping as well.
Look, children not going to school as of Wednesday. Some kids are staying away as of today in many cases. My 8-year-old has been using the word coronavirus, constantly from the time this happened. I would say 95% of the time he uses it in the right context, but I don't think he fully understands the real effects of the disease. How, Rakhi, should we be talking to our children about coronavirus?
So the way we speak to our children needs to be very age appropriate. So we want to focus on basic hygiene practices, and we could use illustrations to show them there's certain bugs and viruses that we can pick up. Depending on how old they are, we want to go very simple with the younger ones. And keep it very, very direct and simple. What do you need from them? So, for example, it means that they need to follow basic hygiene practices, that it means they cannot have play dates, cannot go to school, will not be going to parks and other public areas for a while until the situation is better. So we don't want to create anxiety in children, but we want to show them how we are helping others by doing this. The biggest focus right now is in flattening the curve. So those of us who are perhaps less susceptible, those of us who are well and healthy, have a very important role to play. So what we need to do is make sure that we care for ourselves and care for others so we can flatten the curve and reduce the burden that is going to come to our healthcare system.
So far we have cases of 61 confirmed cases of COVID-19 in South Africa. Trajectory tells us that it's going up, because if you look at last week Sunday we were on air and I reported that there was 3 cases. Fast forward to yesterday and there's 61. So you see where we're going in terms of the trend of this disease. So what about children who are infected with COVID-19? Often you're going to get misinformation out there. You're going to get issues of stigma, discrimination, victimization, ostracization. How does children cope with this?
So we, as parents as well, we need to be very mindful, firstly, of what information we are consuming, and then what information we allow to filter through to our children. We have to be very responsible with media sources. What we consume for ourselves and what we share with others, always verify facts. Read reputable and reliable sources of information, specifically those in World Health Organization and other news sites like the SABC.
All right, Rakhi, appreciate your time and your insight and your perspective. Rakhi Beekrum, counselling psychologist. Thank you very much indeed. Be well.